My hope for healthcare is that we can embrace machine learning to the benefit of all of our patients. But I don't know if you've heard anything about how hard it is, but it's very, very hard for some organizations to adopt it, and it's going to be particularly hard for healthcare, I think. So I think I should start by telling you why I want to do this hard thing, or why I think we should do this hard thing. Since 2012, data scientists have been using deep learning to predict cancer from medical images. And they've met with rather crazy success at this, so much so that the media has declared the end of radiology as a career. I don't think that's the case, and the emerging consensus is more like we're going to mix them together. We're going to bring radiologists and this deep learning together into one system, a kind of digital triage. The highly certain diagnoses are going to be handled by the machine learning, everything else by the radiologists. What this will do is it will remove the radiologist from being the bottleneck in the diagnosis pipeline. It'll allow patients to get their diagnoses faster. It'll allow them to get to treatment faster, and it will allow them to get on with their lives faster. This is a huge impact for a lot of patients. But this isn't the only thing that we can do. My project, my current project at Fraser Health, is a data entry automation task. And the data enterers in this case are registered nurses, quality improvement registered nurses. So when I free up their time by automating some of their data entry, they can take that time and put it into quality improvement projects. Things like reducing the rate of surgical site infections or reducing the rate of accidents and injury in surgery. Another big benefit for a lot of patients, because there are a lot of surgeries going on. But there's even more like this being found in the literature. Things like being able to predict ICU patient crashes hours in advance so that we can prevent them or mitigate them. Other things like predicting rushes on emergency rooms so that we can staff up a few days in advance so that we can prepare. On and on and on. I think healthcare has to do this, but it's going to be hard. Machine learning is hard, and it's going to be particularly hard for us because we've always struggled with adopting new technology. So I'm going to tell you a bit of what you're going to face when you try to do this, some obstacles to adopting machine learning into healthcare. My first one is summed up like this: I don't want to be replaced by a robot. I sympathize with this, but I don't think it's going to happen. Healthcare is so complicated and so people-focused that we're never going to get rid of people in the system. We're going to end up with those mixed solutions everywhere. And it kind of misses the point, too, because healthcare has always had to do more with less, and that's not going to change. Digital triage and these mixed systems are the way to do more with less. The people are always going to be there. We just have to get them used to working with intelligent systems. The second obstacle that I'm going to tell you about. It's impossible for computers to do what humans do. I think you can guess my thoughts on that. But very smart people have been saying things are impossible forever, and they've often been pretty wrong about it. And I think they're wrong in this case, too. Statements of impossibility are really just pointing out often that we need a new way to think, a new training regime to break the 4-minute mile, a new engineering technique to break the sound barrier, something new. Data science and machine learning is the new way to think about what computers are capable of. And it's working. Jeopardy and Go are two games that were never thought to be beatable by computers, and both have fallen over in the last decades. The real key here is that if there's data, then we can get a computer to probably do the impossible, quote, impossible thing. And as we all know, healthcare has tons of data. The final obstacle I'm going to tell you about. You can't do that. You can't access that data. You can't install that program. You can't use our networks that way. If you work in healthcare, you know what I'm talking about. You've experienced this administrative lockdown, and it can be crazy making sometimes. But to that I say, healthcare has many, many terabytes of data available to it, data that could be used to save millions of dollars and thousands of lives, and it's sitting in our databases, not really doing either. I think we need to unlock that potential. I think we need to let our data scientists get access to the data. We need to let them have the freedom to install those programs that they need to do their experiments and build the tools that we'll use. And we need to allow them to deploy those tools that they build to everyone. We need to let them innovate. But there's a catch. We can't tell you ahead of time what we're going to need to innovate. The nature of innovation, to do something that has never been done before, prevents us from telling you what we're going to need. But we can say that what you have right now won't be enough, and that we get new things too slowly. So when our data scientists come to us and say, we're going to fail unless, we need our organizations to accomplish that unless. We need our organizations to do that without compromising security and privacy, and we need them to accomplish that with a newfound swiftness. We can do this. We have all these obstacles and more at Fraser Health. You will too, but we're making progress. In fact, this week, that project I mentioned is launching with a user base. You can do this too. We can all do this, and I think we have to, because machine learning isn't the future anymore. It's really right now. And I think it's healthcare's duty to start saving people's lives with it. Thank you.